Good morning, good afternoon, and good evening, everybody. My name is John Klein. I'm one of the co-moderators for this session, along with my colleague Carol, who will introduce herself in a moment. I'm a professor of pediatrics at Stanford University and also am the president of the International Association for Adolescent Health and a member of the executive committee for the International Pediatric Association. And we're very pleased to be part of the Global Health Council's Global Health Landscape Symposium this morning with an opportunity to talk about adolescent health and well-being and provide an update on some of the global efforts to reach global health and well-being goals for young people. Carol?
Yes, hello. I'm really delighted to be here. My name is Dr. Carol Ford. I'm a professor of pediatrics at the University of Pennsylvania Children's Hospital of Philadelphia, and also editor-in-chief of the Journal of Adolescent Health. And I'm really delighted to be here for this session. Thank you.
So we have a lineup of speakers with representation from World Health Organization, from the Partnership for Maternal and Child Health, or PMNCH, now known as the Partnership for Women's, Children's, and Adolescent Health, and from the International Association for Adolescent Health, and from the Global Measurement Project. And we have about an hour left to talk about some of the developments going on, both optimistic in terms of our ability to understand what young people need and want, and the challenges ahead, both economic and political, that may or may not impede the ability of young people to achieve access to the health and education and other services they need in their communities and their countries. Adolescent health is not a new issue, but the role of adolescents and young adults within the maternal and child survival agenda or within the reproductive health and rights agenda is one that needs to continue to have a spotlight shown on it, given the fact that it's the younger women who are most at risk for the adverse outcomes of pregnancy, whose babies are most at risk for poor newborn outcomes or death, and who have the hardest time getting good access to primary health care and reproductive health services in their communities. So we have a lot of work to do here. But we have some encouraging components too, in that many countries have started to make new commitments to adolescent well-being, including our own United States, where the Take Action agenda for adolescent health and well-being was launched by our Department of Health and Human Services last year during the Global Forum for Adolescence, which we'll hear more about a little bit later in this morning's presentation. So I am very pleased to introduce our first speakers from PMNCH, the Partnership for Women's, Children, and Adolescents Health, with Anshu Mohan being our first speaker, who will talk about that call to action and the commitment by national governments that has been part of that activity, along with Sophie Arsenault, who is one of the PMNCH young vice chairs. So she is one of the under 30 chairs. She also is a director of FOS Feminista, a foundation and civil society organization that is committed to several issues, which she'll share with us. And she'll be talking about the youth agenda in that process. Anshu and Sophie's talks will be followed by Valentina Baltag, who is the unit head for adolescent and young adult health at the World Health Organization, and then by Regina Gotthold, who is a senior technical officer at WHO and who is leading the Global Adolescent Measurement Initiative project. So without further delay, let me go ahead and bring Anshu and Sophie onto the stage, and we will move ahead with the talks. Please let me remind you, if you have questions or comments, feel free to put them directly into the chat. We will be curating them and may bring them up for discussion, or may ask some of the speakers to address them in the chat directly as we go. So, Anshu, the floor is yours. Thank you.
Good afternoon, good evening, good morning to everyone, and thank you, John, for that excellent framing. And and our job is relatively simpler one. It is to frame some of the comments and to give you a little more information on what you've already said. And I do appreciate that I may be preaching to a broad but a very converted church. So, but I just want to take you through some basic principles, and then it'll be over to my colleague Sophie to focus in on commitments. And this is something, John, that you mentioned. So just the bare principles, what are adolescents and what are the 5 domains of adolescent well-being? As we all know, adolescents are defined as 10 to 19 years old. They are about 1.3 billion, translating into 16.5% of the world's population. And in total, 1.9 billion young people, the largest cohort in history of mankind. Apologies, making a distinction between adolescents and young people. While adolescents are 10 to 19, young people are 10 to 24. Now, what actually goes into making the well-being of adolescents? If to your right side on the screen is a little pizza pie that we'd like to call it, it has all the components of adolescent well-being, and these are 5 pillars. And of course, it includes health, the main one of the main pillars. It has education, it has employability, it has connectedness, agency, resilience, and safety. There are subcomponents. These are very broad, all-encompassing themes, and there are 27 subcomponents of it. To just reiterate something that we will discuss throughout this session is to realize adolescent well-being, a multi-sectoral approach is very much required. And throughout the presentation, I'll be putting in links, the various evidence-based pieces that we've done around adolescent well-being in the chat. Please feel free to use them or to ask questions later. Risa, the next one, please. Thank you. This, I appreciate, is a slightly big and a dense slide, but I wanted to make sure that we take you on this journey with us, which started in 2019 and has been a labor of love for most of us around the table this afternoon. We started work on this in September 2019, where the call to action for adolescents was launched. The next most important milestone was about 6 months down the line in October 2022, where the definition and the conceptual framework for adolescent well-being was published. That's the pie chart that I referred to. And all advocacy takes time. We'd got to March 2021 when all the UN heads of agencies and some heads of state signed on to the call to action for adolescent well-being. I'm going to skip through the next couple of years and come to March 2023, where the Adolescent Wellbeing collection on adolescent well-being was launched or was concluded. It's a 2-part collection. And then we were invited by the G20, which was hosted by Government of India, to present the adolescent well-being piece. We were also very much present in September 2023 in New York at the sites of the UN General Assembly to present the adolescent well-being work, and also to give a platform to member states who were making a commitment on adolescent well-being. And very happy to report that there were 20 commitments, and we will speak about them as we go later. 2023 was a huge year for us. We had the Global Forum for Adolescents. We launched the revised Global AHA. My colleagues Regina and Valentina are on the call and they will speak to it. And of course, the Agenda for Action for Adolescents, which is a bringing together of priorities of young people from across the world. We then did not stop fire when the year 2023 ended. We continued with one of the most important pieces of work that we have done for adolescent well-being, which is the launch of the global investment case for adolescent well-being. We've then taken it to the country level. The India case was launched earlier in the year. We are now working with South Africa and Colombia to move forward this piece of work. In parallel, we are working with colleagues to agree on a measurement approach for adolescent well-being. And there is, of course, the trust building and capacity building exercises with initiatives like the professional development course and a MOOC on adolescent well-being. So just to give you a landscape that this did not happen overnight, it's a long journey. We have done much, but heaps needs to be done more. And for that, we need to work collectively on this. Next one, Risa, please. Thank you. Just again to reiterate one of our taglines, why is the well-being of 1.3 billion adolescents important? And if we don't act on it, what do we stand to lose? Well, I mean, we established that the well-being of adolescents is important for various reasons, for societal gains, for development gains, for their own personal gains. But what do we stand to lose? We stand to lose a staggering 4.1 trillion US dollars per annum, or 7.7% of the GDP if we don't take action now. In the fine point at the bottom of the slide, there are some larger figures, which I'm too scared to say out aloud, because it does tend to get the reaction of a very glazed look. But I'm going to test the waters here. We stand to lose a sum of $110 trillion over a course of 27 years if there is lack of action on adolescent well-being. Risa, next one, please. Thank you. Just to also share some of our achievements and some of the things that we are very proud of. These are snippets from all over the world from 2023 October, where the Global Forum was just not a global event. It was held by various national partners. Some on this slide are usual suspects. So you will see India there, Kenya there, but there are some unusual pictures and which kind of take you to geographies which are not mainstreamed as part of this conversation. So you will see Norway. There was a Global Forum event in Norway. There's one in the Netherlands. There was one in Egypt. There was one held by the Arab Coalition. And there was one from Jordan, just to reinforce that adolescent well-being well-being issues are not limited to certain countries. They're very much universal. And you have young people leading and driving this agenda. So on that note, I will go to my next slide, which is going to be my last one before I hand over to my colleagues. But all the slides that I have spoken to earlier, they speak about evidence-based work, which was led by young people. But what about the actual young person on the streets, say, of Delhi, in the streets of Bogota, Colombia? What do they want? So we undertook a massive survey of reaching out to young people to hear what they want and to see if what the evidence is telling us is actually matched by lived experience. This was a bit of a risky affair because this could backfire on us. If young people did not want what the evidence was saying, we would be in a bit of trouble. So anyways, we went ahead with this exercise and we spoke to about 1.5 million young people over in about 90 countries. And what came out was very validating of what the evidence has shown us. Young people across the world want learning, competency, education, skills, and employability, which is one of the key domains of adolescent well-being, safety and supportive environment, good health and optimum nutrition, connectedness, positive values and contribution to society, plus agency and resilience. And of course, the chart is the highest response was for education and employability. The map on the left on the right of the screen represents the geographies where most of the responses came from. I'm going to stop here and hand it over to Sophie to take you through the commitment, please. Thanks very much, Risa. Sophie, over to you.
Thank you, Anshu. As Anshu said, we are very happy to see the outcome of this research, the outcome of this data collection, and in terms of translating it into really tangible action. I was very privileged to take part in the programmatic side of the Global Forum for Adolescents, which really showcased a lot of the, as seen here on the map, the country and the regional commitments to adolescent health and well-being. Speaking as someone from Canada, we were very grateful to see adolescent SRHR be at the forefront of that agenda in terms of the 10-year global, the 10-year commitment to global health. And so here on this map, we can see that across regions, particularly in the Americas and in parts of Africa, we have commitments coming from all over the world on different fronts relating to adolescent health and well-being, with I think a focus on sexual and reproductive health and rights, but really showcasing everything from digital and media literacy to investments in national public health policy, comprehensive sexuality education. And so very grateful to have been a part of this, I think a landmark moment to really ensure that the evidence was translated into real policy commitments and fiscal action. Next slide, please. So in terms of the HCPA commitment to the adolescent wellbeing agenda at the GFA, I want to really narrow in on 3 points here of the 6, speaking to particularly, I think it was points 3 to 5, Anshu, if I'm not wrong, speaking to including adolescents in strategic planning to reflect their voices and needs in health policies, advocating for training to equip healthcare professionals for adolescent appropriate services, and investing in young people, particularly young leaders, by engaging young professionals in leadership and advocacy roles. I tied this back into Anshu's presentation in terms of reflecting what it is that young people were really wanting and how the evidence showcased the next steps for ensuring that adolescent well-being remains at the forefront of our minds. Next slide, please. So the call to action 2.0 was launched at UNGA 79, building on the foundation of the previous call to action. I know that we speak often of what comes next. We have so many calls to action on so many different fronts. And so building on the demands of the agenda for action for adolescents, the Cotonou Youth Action Agenda, and the outcomes of the Global Forum for Adolescents, the Pact for the Future, and Youth Power Summit, we were able to urge governments, donors, and the international community to utilize the adolescent well-being investment cases to secure robust political, financial, and policy commitments, strengthen and ensure meaningful, respectful, equal, and safe inclusion and engagement of adolescents and youth in all of their diversity across international, regional, national, and local decision-making processes, and establish and enforce rigorous accountability mechanisms. I don't know if I have any more slides, but I do see John coming up on this screen. So
You've got a minute to finish up. Yes. Thank you.
I can end on the note that the next actions that we call for your support and for the support of the broader community in this discipline is really to continue to support the development of an inclusive global movement co-owned and co-designed by youth, to integrate youth at the center of the post-2030 development agenda, and to mobilize more commitments from the region. So thank you for holding this space for me, John, and I'll hand it back over to you if there's no more time.
Great. Thank you so much, Sophie and Anshu. And now I think we'll move directly to hear from Dr. Valentina Baltag from World Health. Valentina, if you would bring your video in and come in.
Hi, on my side, the video is on. You don't see it?
Not yet, but we'll find you.
Not yet. Yeah.
I see you, Valentina. You can go ahead.
Yeah.
Go
Okay.
ahead.
I will go without video, but hope meanwhile it will sort itself out.
There we go.
So very pleased to be in this meeting, and I will be presenting a very recent WHO guidance for adolescent health care and well-being, with a focus on quality services and competent providers. Next slide, please. First, let me spend a few seconds in describing the Global Accelerated Action for the Health of Adolescents. We call it the AHA guidance, the second edition of which we have launched in November last year. And this is really the go guidance, one-stop shop if you want to have some answers to the question what government should and can do to improve adolescent health and well-being. As you see, it's not only a WHO guidance, it's really one UN approach, because other UN sisters agencies have contributed and embraced the AHA systematic and evidence-based approach to planning national adolescent health programs. Now, a good program means very many different things, but two elements of it are a backbone. One is a standard-driven approach to improve the quality of healthcare services for adolescents, because the bottom line for the health sector contribution to adolescent health and well-being is to putting in place adolescent responsive services that take a developmental approach to addressing their needs and answer to their expectations. So this is the recommendation in the AHA guidance to position a standard-driven quality improvement within national adolescent health and well-being programs where such exist, or within overall national platforms for quality improvement. Another backbone of a good program is providers' competencies, because we know that the workforce capacity is key to provide adolescent responsive services. And the AHA recommend to focus on creating and implementing competency-based training programs on adolescent health and development in pre-service and continuing professional education. Next slide, please. Now, the first editions of the global standards that you see the cover, global standards for quality healthcare services for adolescents and core competencies in adolescent health and development for primary care providers, were published in 2015. And they were very influential frameworks to inform national policies. Next slide, please. In this slide, you will see some stats. For example, in our policy survey that we conduct with member states every couple of years, the majority of countries, 93 in this slide, answered yes, we do have national standards for quality healthcare services for adolescents, and they were influenced by the global standards. And similarly for competencies, next slide, you can see that the majority of respondent countries, 80 countries in this case, in our last survey, say that they have national guidelines for competencies for healthcare workers in adolescent health. But there is always a but, isn't it? Next slide. Even though some countries or many countries have national standards, not everyone monitors them regularly or have a very clear, defined, comprehensive package of services and also regular monitoring activities. So you can see, for example, that look at the bottom bar, which shows the global picture, that some countries have national standards only, the green box, without any monitoring activities and without some other explicit elements to the quality of those standards. Next. And for competencies as well, yes, they have competencies framework for providers, but continuous professional education systems in place for primary care clinicians, those that are the first point of contact with adolescents, are not in place in the majority of respondent countries. Next slide. So we set up to develop the second edition of those standards for several reasons. One, that there was a progress in countries, and we have many examples in the AHA guidance documented how countries have started to think about the pre-service education and adolescent health care. Here is the example of Mauritius that wants to train their pediatricians because they increased the age of pediatrics from 12 to 16. And here is the example from Ghana that have trained their school health nurses in boarding schools to provide adolescent responsive care. Next slide. The other reasons to develop second edition and to revise what we have written in 2015 is that there are several advances that warrant attention in those kind of documents: telehealth and telemedicine, self-care agenda, learning from COVID-19 pandemic. What does it mean to have a pandemic preparedness for primary care providers, for example, climate change? So all this is not reflected in our first edition. And as well, in 2022, WHO has published a global competency and outcomes framework for universal health coverage. And therefore, we think we need to align with health system strengthening efforts. The way we communicate adolescent competencies should be aligned with this global competency and outcome framework for universal health coverage. Next slide. We set up a partnership to engage in this process with several entities, and first of all, International Association for Adolescent Health. And we will publish the second edition of this guidance next year. Next slide, please. And I'm taking the opportunity of this event to tell you that we in WHO believe that linking or putting services close to where students and adolescents are is very important. And developing school health services models of care is very important in this regard. In 2021, we published the WHO guideline on school health services, which has a menu of 87 interventions. And now we are working on the implementation guidance for school health services, which we have put up for public consultation, the draft yesterday, and we would be happy to share with participants at this event. So you share it within your networks to get your feedback to this guidance. I will stop here. Thank you very much for your attention. Very happy to answer follow-up questions.
Thank you so much, Valentina. And let's go directly over to Dr. Regina Goodhold, also from WHO, who will talk about the Global Adolescent Measurement Initiative.
Thank you very much. Indeed, I will be talking about measurement. And as the former Director General of the World Health Organization used to say, what gets measured gets done. So that highlights the importance of measurement. Next slide, please. The Global Action for Measurement of Adolescent Health, in short, GAMA, that is an advisory group on adolescent health measurement. And this group was established by the World Health Organization in 2018, 6 years ago, and it is supported by other UN agencies, UNAIDS, UNESCO, UNFPA, UNICEF, UN Women, the World Bank Group, and the World Food Programme. The aim of this group, and really the entire initiative, is to improve and harmonize adolescent health measurement globally. The specific objectives of the group were set in 2018, and they were to define a set of core indicators for adolescent health measurement, along with guidance on their measurement, so that countries could get a comprehensive view of the health of their adolescent population, and then to promote harmonized guidance for adolescent health measurement. So the group embarked on a 6-year journey, next slide please, to select core indicators for adolescent health measurement at national, subnational, but also global level. And this set of actually 47 recommended indicators was published in May this year. And they're organized around 6 domains. Click again. So the first domain is policies, programs, and laws with 4 indicators. For example, the existence of a national adolescent health program in a country. But there are also other indicators. Click. Systems performance and interventions is another domain that groups 4 indicators. For example, health services used by adolescents or HPV vaccine coverage. There is a domain on health determinants, including lots of indicators that determine adolescent health, such as around education or poverty. Click. The domain health behaviors and risks includes a great number of indicators, for example, overweight and obesity, physical activity, e-cigarette use, or bullying. Click. The domain subjective well-being is a less studied, less researched area, and therefore only has 2 indicators for now: someone to talk to about problems and adolescents having positive family relationships. Click. Finally, the domain health outcomes and conditions includes a bigger number of indicators, for example, HIV prevalence, anemia, suicide attempt. So together, these 47 indicators, if measured by countries, provide a very comprehensive picture of the health of adolescents. And just to say, they build on existing initiatives, and they have been very carefully selected through a 6-year systematic process, including a feasibility testing in 12 countries. And many countries already have data for many of the indicators. I'll come to resources that you can use to track these indicators. Next slide, please. Now, after the selection process for these indicators has started, this pizza pie, as Anshu Mohan referred to, was published, the Adolescent Well-Being Framework, where health is really only a part of the broader adolescent well-being. But these indicators that I just presented can be mapped onto this framework as well, and they do cover all of these domains. Click again, please. These are just examples of gamma recommended indicators and how they map onto the different well-being domains. So for example, in the domain connectedness, there are these 2 well-being indicators: having someone to talk to about problems or positive family relationships. In the part on education, learning, there is indicators such as school completion and foundational learning skills. Next slide, please. Here are the resources for the gamma recommended indicators. There is an indicator document. It's a guidance for countries on how to monitor these indicators. There is also the second resource there, an online toolkit that presents the metadata, the measurement details for each indicator. And a supplement was published in the Journal of Adolescent Health with 16 papers that describe in detail the selection process. Forthcoming are resources around well-being measurement that, of course, integrate the gamma indicators, an adolescent well-being measurement guidance to be published in May 2025, as well as a tool that allows countries to report, to map and report their own data on adolescent health and well-being for these indicators and beyond. Thank you very much.
Thank you so much, Regina. Wonderful presentation. And now we're going to move on. I'll be introducing Dr. Jason Nagata, who's an associate professor of pediatrics in the Division of Adolescent and Young Adult Medicine at University of California, San Francisco, and the Institute for Global Health Sciences. Dr. Jason Nagata will present the leading work of young professionals in the International Association of Adolescent Health and the Second Lancet Commission for Adolescent Health. Jason?
Thank you so much. So the International Association of Adolescent Health has an emerging professionals network, which is a diverse network of students, trainees, and early career professionals working in or studying adolescent health. And the overall goal of this sub-organization of IAAH is to support networking, mentorship, leadership development, and provide a forum to share training opportunities in adolescent health. I was very fortunate, next slide, to be involved in the co-founding of the organization back in 2018. And we also have very strong co-chairs, as well as, next slide, as well as officers from all over the world. Next slide. And so you can see there's great geographic representation. And I will just note that we are currently recruiting for an officer from North America if anyone is interested. Next slide. The overall goals of the Emerging Professionals Network are to provide diverse opportunities for the EPN to advance their knowledge, skills, and experience in the field of adolescent health, to promote collaboration and build relationships between the EPN and more experienced professionals and leaders in adolescent health, and to provide a collective voice advocating for adolescent health and well-being. Next slide. We also have a webinar series that spans topics of relevance to students, trainees, and emerging professionals in adolescent health. We do have the webinars live, but they are also recorded on YouTube, and here's a QR code where you can view past webinars if of interest. Next slide. I also am very happy to share a little bit of a preview of the second Lancet Commission on Adolescent Health and Wellbeing. So the first commission for the Lancet on adolescent health and well-being was published in 2016. And this follow-up commission, which aims to publish in mid-2025, is a follow-up. Next slide. These are some of the current commissioners and leads, including youth commissioners. Next slide. And the overall goal of the commission is really to focus on solutions, focusing on investment barriers, political and economic discourses, intergenerational perspectives, and the need to balance older adults' demands with younger people's needs. Next slide. I think one of the features of the commission is really trying to figure out how to engage meaningfully with various young people, youth, adolescents. And so there are several ways that this has been implemented. So first, there are youth commissioners who are core commissioners of the Lancet Commission, who are passionate youth advocates, researchers, and early career professionals under 35 working in adolescent health and well-being. As well, the Youth Solutions Lab brought together youth between ages 16 to 20 from all over the world to help develop innovative solutions for some of the most pressing challenges adolescents face today. And so there were 6 participatory labs focused on mental and emotional health care, education and employment gaps, sexual reproductive health education, meaningful youth civic engagement around climate change, and healthy lifestyles and nutrition. In addition, there were a multidisciplinary youth review group. So actually, as part of the peer review process, there were youth who were enlisted to participate as peer reviewers and who also attended all the commission meetings. Next slide. The commission employs a rigorous methodology with new analyses in several different areas. Slide. Next slide. And just as a brief overview, the commission will talk about opportunities for multi-sectoral action to address adolescent health and well-being, as well as rebalancing systems for adolescent health and well-being. So the next few slides are just some photos from the commission meetings. The first was in Nairobi, and then the second was in Cape Town, which were working meetings. And I'm pleased that the draft of the commission is now under review. And I think just as a way of highlighting one of the sort of main points, next slide. One of the sort of summary quotations is, adolescent health and well-being matters now. When they are young and beginning to change our world, the investments we make in this generation will determine our human and planetary futures for good or for ill. So hope that we'll be able to share more with you in May 2025. We're anticipating a launch around the time of the World Health Assembly. Thanks so much.
Thank you so much, Dr. Nagata. And next we'll move on. We will now move on to Dr. Jonathan Klein and Ms. Risa Turetsky from Stanford School of Medicine, who will outline the aligned advocacy work and commitments made by healthcare professional societies, highlighting the International Pediatric Association, or IPA, and the International Association for Adolescent Health, IAAH.
Thanks, Carol. Next slide, Risa. So we already saw when Sophie put up the Healthcare Professional Association's commitment that was made during the Global Forum for Adolescence, and the origin of this really started with the International Pediatric Association's work with the other healthcare professional associations that are a leadership part of the PMNCH. And although Sophie highlighted the engagement of adolescents in this, I want to call attention actually to some of the other points. Strengthening collaboration among different health professional organizations is a commitment made by the global pediatric OBGYN and midwifery and nursing organizations as a working principle to engage collaborative advocacy within countries and to engage with ministries around the need for commitments to adolescent health, ensuring respectful and confidential care, especially for adolescents and vulnerable groups, and the workforce issue, of course, which Sophie already did mention, but promoting universal access to sexual and reproductive health services and education as a core component of what healthcare professionals recognize is needed here. Next slide. Some of this is reflected in commitments that were made by the individual associations. So, for example, here is the IPA's commitment with when Dr. Naveen Thakur took on the presidency in 2023. There were specific commitments made to school-age children and to adolescents as part of the mission of the association. Next slide. And this is the U.S. example that I referred to at the beginning, where the call to action has been translated directly into specific national goals, which include eliminating disparities, increasing youth agency and engagement, ensuring access to safe and supportive environments, coordination and collaboration, training, better health information and health literacy, access to health and human services, and supporting and translating and disseminating research. So it gives us an opportunity for each of those national commitments to be part of not just the healthcare professional organizations collectively advocating for commitments, but advocating for accountability for those commitments at the national level as well. Next slide. So let me pass this over to Risa to talk about the International Adolescent Health Group's components.
Thank you very much, John. And I'll be very quick for the sake of Q&A. At the International Association for Adolescent Health, our mission is to enhance individual competencies, national capacity, and global investment in adolescent health. Through bringing together multidisciplinary professionals who work with adolescents, as well as the organizations such as IPA that John discussed, who are supporting them. And then we also bring young people themselves, as Jason spoke about. These are our 4 focus areas for moving the ball forward in adolescent health and healthcare workforce development. I want to highlight the International Adolescent Health Week that we support, whose mission is to inspire adolescents and their communities to advocate for a successful transition into adulthood. This is one of the things that really bring us forward in terms of our commitment to adolescent health. And you can see how fully representative this group is, really spanning the globe and bringing adolescents and young people to the lead in developing and bringing forward these groups. And we do this annually. And finally, we hope that we'll see you in 2025 at one of the World Congresses, either for the International Pediatric Association or the International Association for Adolescent Health. So you know the IAH World Congress is accepting submissions currently until December or January, and I'll share the link in the chat. Thank you so much.
So we now have the floor open for questions and discussion, and I would invite all of our panelists to bring themselves back on camera and also invite any of our audience as well to turn your cameras on. I think we'll take the slides off so that people can see each other a bit better. And I know there have been a couple of comments into the chat, and I think I'll turn it over to Carol to start the discussion.
Yeah. Thank you. I think in the interest of time, we'll limit the questions, but there's one that I think is a really important question. And Dr. Baltag tried to answer it, but basically I'm going to give her an opportunity to say more. But the question was really, WHO has created many wonderful frameworks and policies. Who can ensure implementation of these policies? Is it government, NGOs, WHO itself? It is, if it's government or NGOs, where's the funding coming from? And I would like to give this to Dr. Baltag. She did put some resources and comments in the chat. But Dr. Baltag, you want to take that?
Thank you. Thank you. So we as a technical agency, our primary customer are ministries of health in countries. But because health is inseparable from other elements of the well-being, so it's not only the ministries of health we work very closely, but also ministries of education, ministries of social protection, and other ministries working the talk on intersectoral approach. So our guidance is primarily addressed to government agencies, and the intention is to support governments to put in place evidence-based policies and practices. But governments rarely work in isolation, and especially in low and middle income countries, the role of developmental partner is huge, and other UN agencies, unlike WHO that is a technical agency, other UN agencies have more of the implementation mandate and funding activities for implementation. UNICEF is an example, UNFPA is another example. So there are many partners that are involved in implementing the policies. But I just want to take a few seconds to explain that what we decide to do in terms of the guidance is very much informed by the country needs. We have a process whereby country offices and regional offices, because WHO has huge presence in countries, with country offices in over 140 countries. So we hear from them what the needs are before we develop a guidance. So yes, there are many policies and frameworks, but they cover different aspects of different level of accountability. Some are of national framework, some are really the implementation guidance nitty-gritties that provide step-by-step guidance of process. And for the resources that I said in the chat, the resources in low and middle income countries largely until recently came from developmental assistance as well as domestic resources. Now the push is more domestic resources to be put, especially in adolescent health programs that traditionally had a huge component of donor support. As for WHO, we fund proof of concept lines of work as well as technical assistance and policy dialogues with countries. Thank you. I hope this answers your question.
Thank you, Dr. Baltag. And Anshu, I see you have your hand up, and also you had some comments in the chat if you'd like to elaborate. John, do we have time just for a few comments from Anshu?
We do.
Great.
I think we can go another 3 or 4 minutes before.
Okay, great.
Super. And thank you very much, Valentina. I just wanted to come in support of what Valentina has said, and also to bring in the element of accountability. I mean, it's just not WHO, governments or NGO, it's all of us who need to put our shoulder to the wheel, and we all have different roles to play. So PMNCH as an advocating partner works with stakeholders on the ground to make sure that there is a commitment. And Sophie's presentation spoke to commitments, which is an articulation of a government's intention to invest more in this population group, but not just governments alone, young people themselves, the ARTs, the HCPA. John spoke about their commitment. Everybody needs to come to this well together and work together on this. And it is everybody's responsibility, and we need to hold each other accountable. We need to set up a system of 360-degree mutual accountability to make sure that the needs and demands of this population group are acted upon. And this is the time, not only as we are moving towards the SDGs, but also as we are starting to think about setting the agenda for the post-2030. period. So yes, we all need to do this together. Thank you very much, Carol, and back to you.
Thank you. And I'm going to turn over to Dr. Klein for the closing summary statements.
Thank you, Carolyn. Thank you to all the speakers and to the audience members, most of whom I see are still behind their little black boxes on the screen, but we really appreciate you being here with us today. I think when we look at what our societies are doing, whether it's our national societies, our countries, our communities, or our professional societies, adolescence needs are competing with many other parts of the life course and many other services that are needed. And those of us who work in adolescent health, I think, see the obvious connections to the future population and to our future leaders, as well as our current engagement with leadership. But many people don't recognize the opportunity to call attention to young people and to address mental health, environmental health, primary care services, some of the basic needs that have been well defined in the health and well-being framework. And so we hope that all of you will take what you've heard today back to the various places where you interact with other parts of the health and public health and social systems that you're in and that you work in, and think about that approach to comprehensive services and the ability to recognize adolescents and young adults as a unique opportunity to invest in the life course, both for their health, for their future adult health, and for the health of the next generation of their children. So thank you all for being with us this morning, and we're going to turn this back over to the program folks at the Global Health Council. And Fernando, I wish we had more time to talk about accountability and implementation, because I think you're asking the questions that we're all struggling with every day when it comes to both resources and sustainability of commitments. And I hope you'll follow up and be in contact with several of us to continue that dialogue. Thanks again, everybody.